Hi guys, my name is Ashley Peterman, and the genetic disorder that I will be presenting on is SS disease, or more commonly known as sickle cell anemia. So first, what is sickle cell anemia? It is the most common form of sickle cell disease that is inherited and passed down through families. This genetic disorder affects hemoglobin, which is the molecule in red blood cells that delivers oxygen to cells throughout the body. People with this condition have atypical hemoglobin molecules called hemoglobin S, which can distort red blood cells into a sickle shape. So normally your red blood cells are flexible and round and move easily through your blood vessels. However, in sickle cell anemia, the red blood cells become rigid and sticky, and due to their irregular shape, they can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. So now let's discuss the major characteristics of sickle cell anemia. So signs and symptoms of sickle cell anemia usually begin in early childhood. Some major characteristics of this disorder include a low number of red blood cells or anemia, repeated frequent infections, periodic episodes of pain, painful swelling of hands and feet, delayed child growth and development, and vision problems. When sickle cell anemia results in more severe episodes, other symptoms that can occur are shortness of breath, fatigue, yellowing of eyes and skin, or jaundice, paleness, rapid heart rate, ulcers, and painful prolonged erections. So now that I've introduced sickle cell anemia and some of its defining characteristics, so what is the molecular cause of this genetic disorder? So sickle cell disease is caused by mutations in the HBB gene in humans. Hemoglobin consists of four protein subunits, typically two subunits called alpha globin and two subunits called beta globin. So in sickle cell anemia, both beta globin subunits are replaced with hemoglobin S. So these abnormal versions of beta globin can distort red blood cells into a sickle shape. So now let's talk about the mode of inheritance. So sickle cell anemia is inherited in an autosomal recessive pattern where both copies of the gene in each cell have mutations. So while signs and symptoms are seldom present in the parents of someone with an autosomal recessive condition, each parent carries one copy of that mutated gene. So let's look at an example of the inheritance pattern using a pedigree. So first, let's look at the very top, at the couple of William and Linda. So they are both carriers of sickle cell anemia, but remain unaffected or non-symptomatic. However, they will have a 25% chance of having an unaffected child, a 50% chance of having a child who is a carrier of the mutated gene yet unaffected, and a 25% chance that the child will have sickle cell disease. So let's look at one more example. So look at the far left of the couple of Michael and Julie, for instance. So Michael has sickle cell anemia, and Julie is a carrier for sickle cell anemia. So their children will have a 50% chance of having sickle cell anemia and a 50% chance of being a carrier for sickle cell anemia. Next, let's look at the prevalence and frequency of sickle cell anemia. So sickle cell disease affects millions of people worldwide. It is the most common inherited blood disorder in the United States, affecting 70 to 80,000 Americans. This disease is estimated to occur in 1 in 500 African Americans and 1 in 1,000 to 1,400 Hispanic Americans. It is most common among people whose ancestors come from Africa, Mediterranean countries such as Greece, Turkey, and Italy, the Arabian Peninsula, India, Spanish-speaking regions in South America, Central America, and parts of the Caribbean. So now let's talk about treatment. Treatment options, I should say, for individuals with sickle cell anemia. The overall goal of treating this disease is to manage and control symptoms and limit the number of crises that occur with ongoing treatment. So an example of this could be folic acid supplements, which prove to be beneficial for individuals with sickle cell anemia, as folic acid helps make new red blood cells. So a couple other treatment options for sickle cell anemia include, but are not limited to, blood transfusions, pain medicines, plenty of fluid, hydroxyurea, which helps reduce the number of pain episodes, antibiotics to prevent bacterial infections that are common with sickle cell disease, and medicines to reduce the amount of iron in the body. And then on the other hand, there's some treatments that are used for managing complications that include dialysis or kidney transplant for kidney disease, psychological counseling, gallbladder removal in people with gallstone disease, hip replacement for avascular necrosis of the hip, and surgery for eye problems. So we'll go to options for genetic testing next. So the most common specific genetic testing options for sickle cell anemia include, but again are not limited to, hemoglobin electrophoresis, amniocentesis, and pre-implantation genetic diagnosis, also known as PGD. So hemoglobin electrophoresis is a blood test that looks for the defective hemoglobin S and is further examined under a microscope to identify any large amounts of sickled red blood cells. Amniocentesis is a form of prenatal genetic testing that can be described as a procedure in which fluid is taken from around the baby and tested in order to determine if the fetus has sickle cell disease or is a carrier for sickle cell disease. And then you have pre-implantation genetic diagnosis, or again, PGD. It is a technique used in conjunction with in vitro fertilization that allows parents that are carriers for the sickle cell gene to test embryos for the defective gene before implantation. And next, let's talk about when should genetic testing be done for sickle cell anemia. So early detection for sickle cell anemia is essential, as beginning treatments for this condition at an early stage can reduce the potential risks of life-threatening complications such as severe infections or strokes. And then sickle cell anemia testing should occur before or during pregnancy, directly after birth, and in adulthood. And as part of the newborn screening program, infants in the United States are screened for sickle cell anemia within 24 to 48 hours after birth. However, prenatal sickle cell anemia genetic testing is optional. And lastly, is there a cure? So the only known potential cures for sickle cell anemia are bone marrow transplants and stem cell transplants. But this treatment is only an option for those who find well-matched stem donors. And here are my references. And that is it. Thanks everyone for listening, and I hope you enjoyed my presentation on sickle cell anemia.